Good day, fellow classmates of the Human Behavior and the Social Environment. This is Lauren Kohler, and I will be discussing the social problem of adolescent suicides in the United States. According to the Centers for Disease Control and Prevention, suicide is the second leading cause of death among youth aged 15 to 24, and also the second leading cause of death among youth aged 10 to 14. Among youth who identify as sexual minorities, the likelihood of death by suicide has been estimated to be 2 to 7 times greater than the likelihood of death by suicide among heterosexual youth. The CDC published suicide rates for the year 2015, which showed an overall increase in the suicides among adolescent males and females ages 15 to 19 years old. Specifically, they listed that in 2015, there were 1,537 deaths by suicide among teen males and 524 deaths by suicide among females between the ages of 15 and 19. CDC suicide expert Thomas Simon stated in a CNN interview, "We know that overall in the US, we're seeing increases in suicide rates across all age groups. As evidenced by the statistics, males experience a higher rate of death by suicide than females. This is due to their higher rate of successful suicides. However, teen females actually have an attempted suicide rate that's 4 times greater. Each day in our nation, there are an average of over 3,470 attempts by young people in high school. Again, 3,470 suicide attempts by high schoolers every day. The ratio of suicide attempts to suicide death in youth is estimated to be about 25 to 1. So 25 suicide attempts for every one successful suicide. And that statistic is from the American Foundation for Suicide Prevention. Okay, let's take a look at a risky behavior survey administered to high school youth by the CDC. The percentages reflect the results for high school youth in Kentucky as compared to the whole US. I'm not tech savvy, so I wrote on a whiteboard. Okay, as you can see, here is the column for percentages in Kentucky and for the USA. I don't know, it looks like it's showing up backward on there. I'm really sorry. The other video I did, it was normal, so we're just going to do it backward. Okay, if I can read it backward that is. Let's see. High school youth regularly felt sad or hopeless. That's 31.3% in Kentucky and 29.9% in the US overall. Youth who seriously considered committing suicide was 15.7% in Kentucky and 17.7% in the US. Youth who made a plan to commit suicide was 13.9% in Kentucky and 14.6% in the US. Those who attempted suicide is 9.4% in Kentucky. So think about that. That's almost 10%, or 1 out of 10 youth in high school have attempted suicide in Kentucky, and it's 8.6% overall in the US. Those who have attempted suicide and needed to be treated by a doctor or nurse afterward is just 3.9% in Kentucky and 2.8%. Now think about that. So those are ones that definitely got reported because they had to seek medical attention. And that's why the reporting numbers are difficult, because a lot of the attempts don't actually get reported. Okay. So most teens who have been interviewed after a suicide attempt say that the causes of teen suicide are feelings of hopelessness and helplessness. These overwhelming emotions result in teenagers feeling out of control of their situation with no solution or end in sight besides taking their own life, besides ending the pain through death. Emotional factors contributing to teen suicide include the desire to escape feelings of pain, rejection and hurt, being unloved, a fear of disappointing or burdening others, The combination of environmental factors, such as bullying, abuse, loss of a loved one, or detrimental loss in the home, often contribute to the emotional causes of suicide. However, underlying issues such as mental illnesses like depression, bipolar disorder, and borderline personality disorder are also driving factors as they amplify a teen's pain and hopelessness. Going back to the statistics I stated earlier, the Center for Disease Control admits that it is difficult to get an accurate number for teens who experience a failed suicide attempt because many of those attempts are never reported. Additionally, a small number of suicides are reported as being caused by something else, like death by choking or undetermined death. So, for example, I don't know if you know about the choking game, but kids will choke themselves out, do a blood choke, which gives kind of a euphoric feeling in your head. Dr. Leon Kelly, Deputy Chief Medical Examiner at the Coroner's Office in El Paso County, Texas, says family members almost always request that his office cite a cause of death other than suicide, such as the choking game. He says, I've had relatives ask me if I would call it an autoerotic asphyxia because they didn't want to have to tell grandpa that his grandson had committed suicide. He says, this really speaks to what we as Americans think about mental illness. This also serves as a clear example of the cultural mechanisms that make it so difficult for preventative strategies and interventions to work. If we aren't willing to admit that there is a problem, how can we expect to fix it? Additionally, if we continue to allow the cycle of socialization to perpetuate myths surrounding suicide in addition to the negative perceptions about mental health, we will continue to see a rise in the numbers of youth dying by suicide each year. So let's take a look at some of the common myths. 1. People who talk about suicide won't really do it. A threat of suicide should never be dismissed, even from a kid who cries wolf so many times that it's tempting to stop taking them seriously. It's important to respond to threats and other warning signs in a serious and thoughtful manner. They don't automatically mean that a child is going to attempt suicide, but that's not something we want to risk. According to the Jason Foundation, 4 out of 5 youths give clear warning signs through their words or behaviors. In fact, a 17-year-old girl from Colorado Springs, Colorado, hung herself in her room, and while she was dying, she sent messages from her phone stating, "My feet are off the floor. Everything is getting hazy and dark." And a friend responded by suggesting that she unhang herself. Myth number 2. If a person is determined to kill themselves, nothing's going to stop them. Most suicidal people don't want to die. They just want the pain to stop. And in that moment, dying seems like the only way to make it stop. Myth number 3. Talking about suicide may give someone the idea. Actually, the opposite is true. If a person is depressed or unhappy, discussing their feelings openly and allowing them to express how they feel is one of the most helpful things you can do. Even if they have suicidal thoughts, giving them permission to express those thoughts can relieve some of the anxiety and provide an avenue to recognize other ways besides suicide to escape their pain and sadness. Myth number 4. People who attempt suicide and don't die are just trying to get attention. 9 out of 10 teenagers who try or succeed at committing suicide have a mental illness, which is usually depression. Even if the suicide attempt, even if what appeared to be a suicide attempt was really non-suicidal self-injury, such as cutting, this is still a teenager struggling who needs support, and their actions need to be taken seriously. As social workers, we need to be the driving force behind changing the conversation on teen suicide and also on mental health. So what can we do to help prevent teen suicides? Generally speaking, factors that protect against suicide in youth include having a positive relationship with one or more parent or an adult figure in their life, feeling positively connected to and included in school settings, as well as feeling involved in a group of peers. Also, we can help families to develop adaptive coping mechanisms to serve as protective factor against youth suicidal behavior and ideation, and teaching youth their own coping mechanisms so that they are able to cope with these overwhelming emotions in productive ways and non-harmful ways. Specific to sexual minority youth, family cohesion, school safety, and the perception of being cared for and about by adults outside the nuclear family have been found to lower the risk of suicide and suicidal ideation. So having those strong adult relationships is important. Family and peer support has also been shown to have a comparably favorable effect on reducing suicidal ideation and completion. So building strong family relationships, especially as marriage and family therapist. Various therapeutic modalities have also been found to reduce suicidal ideation among adults and adolescents. Again, however, the major factor that we can help change as social workers is the way our country views mental health problems and the myths surrounding suicide. So again, we're talking about the cycle of socialization and the way that our society on the individual, social, and institutional levels talk about mental health and suicide. Thank you so much for listening. I hope that you were able to learn something and feel passionate about these youth that are struggling and need our help. And please let me know if you have any questions or suggestions. Thanks.